All right, for simulation today, I want to start off with that we believe everyone participating in this sim experience is intelligent and cares about their best and wants to improve in their clinical outcomes and practice along with patient outcomes. Learners may feel pushed to the edge of their comfort zone. Learning and interacting with new information may be uncomfortable. So today, we will be going over the Doris Bowman simulation. Your objectives today are to recognize a mental health status change in the patient, identify and safely implement priority nursing care for a patient experiencing mental and physical status change, perform safe medication administration and documentation, along with incorporating effective communication, patient education, and family education. Bathroom usage is free to go on your own. Please go if you have to, and cell phones are to be kept in your pocket unless an emergency or math. Your roles today are going to be your primary RN1, who is the main nurse. RN2 is going to be your wingman or your buddy. AP, UAP, CNA is going to be your assistant personnel. And then we will have a family member. Your scene time frame today is going to be 20 minutes long, so our debrief will approximately take 40 minutes. I want to remind learners that this is a fiction contract and to create the sim as if it was realistic. Suspend disbelief and deliberate in practice. Today, anything that happens in simulation stays in simulation. Nothing will be talked outside of here. So if you are concerned or unsure of what to do something and we'll talk about it in debrief. Okay. We're going to go through our orientation to our environment and we will start with the Pyxis. Your Pyxis sign-in is going to be in the bottom left-hand corner. It's going to be SimRN and 6666. You will have a screen that comes up. You will use all available patients and type in the first 3 letters of the last name of your patient. You will then be able to go into their screen and remove the medications. If you need any IV fluids, this is on the side along with any supplies that you may need. We will now do an orientation to the room. Today we'll be doing our simulation in Sim Room 2 today, where you will be using equipment such as manipulating the bed. The bed has on the side 2 buttons for head up, head down, to raise the whole bed up and down. On the back here, you have your suction manometer to use for suction if you need it, for continuous or intermittent. Over here is going to be your nasal flow meter for your oxygen today. Okay. On the top of the red cart over here, we do have your gloves that you will be using. And in the top of the drawer, you have your IV tubing and your flushes along with your glucometer strips. In the second drawer, you have wound dressing supplies and gauze. And your third is going to be your oxygen devices of any sort. Your whiteboard is here up on your wall. Your hand hygiene is over here, and your sharps container is here. That is the conclusion of the orientation to your environment.